Many people don't realize that there's a big difference between getting your liposuction in an accredited surgery center with a board-certified plastic surgeon versus getting a little quickie lipo in the little quickie clinic where you're in an office and you're awake. There are limitations to that procedure. The main limitation is your comfort. It's not comfortable to get a procedure when you're awake. And the other limitation is that there are limitations to the volume that can be taken in the office setting. So most of the time the volume is limited to 1 liter, which in many of my patients would make almost no difference. And I see that when people tell me they've come to me and they've said, oh, I had lipo a couple years ago in such and such office. I said, were you awake? Yes, I was awake. You know, I really didn't see a difference. And I know right away why, because they don't take very much, and that's intentional. When I take my patients to the certified accredited outpatient surgery center, we're operating in the safest setting with a real doctor for your anesthesiologist. I have the flexibility to position you properly so that I can see the area that I'm working on. And I also have the flexibility to take a larger amount of volume and so that I can safely get you to the result that we're actually looking for. And so that's key. The other thing that's important is I mentioned the positioning. Many times to cut corners, the quickie clinics will not position you, meaning they won't turn you to one side or the other or turn you over on your stomach to do lipo, for example, on your back or on your hips. And so I have seen patients laying on their back getting liposuction on their hips. So I don't know how that's possible to get a good result because you can't see the hips if the patient's not laying on their stomach. And so we take the time to actually safely reposition you so that we can see the area that we're working on in order to get you the optimal result that we're looking for.